Dr. Pan Xu is a specialist in acupuncture and Chinese massage. Working in the area for more than a decade, his hands appear magical to his patients. Jabber, a local resident who suffered from high blood pressure and a stroke, has received treatment for some time. He was introduced here by his friends. Now he loves it because it is effective and affordable.
I'm recovering well because before I can't walk, now I can walk a little bit. The problem now is my hand, and I'm still going with the treatment. And the doctor, he gave me the hope I can recover well.
The Dr. Pan, the biggest problem here in practicing traditional Chinese treatments is a lack of equipment. In China, the majority of needles used for acupuncture are disposable. But here in Zanzibar, they have to be recycled because the new ones are often used up quickly, with nothing to replace them.
The medical materials we brought often used up quickly. If the needle is recycled too many times, I can feel it goes blunt. To patients, they will feel a bit pain, but I don't have any new ones to replace them. I feel sorry for them, though my patients never complain.
On the other side of the hospital, the clock is ticking by for an important surgery. Wu Weiyan is the doctor who is in charge of this. Being the only female doctor in the entire team, Dr. Wu has a very busy schedule. She is often woken up in the middle of the night for emergencies.
The
maternal mortality rate in Africa is very high. For example, last year this hospital received more than 10,000 maternal women. Nearly 40 died. This means each month there are 3 women who died from their delivery. This number would be unacceptable in China, but here it is normal. Since I've come here, I've tried my best to save lives, as many as I can.
Haji has been the nursing supervisor in the operating room for more than 20 years. He has witnessed changes brought about by the Chinese medical team in the past few years.
The challenge of materials. We are thinking that the example if the Chinese team coming, okay, they come with their materials sometimes, so they help us a lot. Even when you see our heads, our masks, we get from them, all right. Some equipment like diathermy, and now we have laparoscopic. Here we are starting laparoscopy since 2012. We started laparoscopic operation the first time here in Zanzibar, and this is the new type of surgery, non-invasive surgery. So we thank them very much.
Dr. Xu Zhuoqun is the oldest member of the medical team, and he is also the leader. He told us that being the doctor in Africa means that you have to prepare for the worst. Not long ago, the power went down suddenly in the middle of his surgery. He had to use mobile phones to provide sufficient lighting.
The Chinese medical team is considered as a group of experts here. We are all on duty 24/7. When local doctors cannot handle the case, with just a phone call, we will be at the scene right away. Each of us has to take care of different departments. As we are short of people, we work as a team and we help each other out.
To all the members of the Chinese medical team, now and in the past, Ms. Hassan is a name that is known to all. More than 40 years ago, she was deeply grateful to the Chinese who helped her to deliver her eldest son. Every year, she is invited to China to pay a visit to Dr. Yan, who helped in the delivery.
Since that, I said me with Chinese people will be like this. They have saved my life. They have saved my baby's life. So I can't forget. I can't forget.
Apart from work within the hospital, the team members also visit rural areas to attend free clinics. 5 months have already passed, and members of the medical team have gradually adapted to life here. And for the remaining 1 year and a half, there is much work awaiting them to pass on their skills and to help more people. Xu Wenjing, CCTV, Zanzibar.